Hey guys, thanks for joining us again today. We are talking about short term health plans. Okay, so first off, we are drinking our LaCroix always. And my name is Laura Sullivan, and this is Inge Johnstone with Johnstone Carroll Law Firm. So, specifically, the people that we are talking to are from Arizona. So, Inge, what is short term health plans and what do we need to know about them?
Okay, so short-term health insurance is a type of insurance that's existed for a long period of time, but it became popular starting when Obamacare and the Affordable Care Act was passed. We started seeing a lot of these healthcare plans popping up and appearing in the marketplace. Specifically, in the last couple of years, the federal government has made it easier to issue these plans for periods as long as a year, and they can be renewed up to 3 times. And Arizona has also done the same thing. Arizona and some other states have done the same thing and allowed these plans, made it easier to issue them. So these plans, though, often are marketed as comprehensive health care, and sometimes they're even marketed as if they're Obamacare or Affordable Care Act plans. The problem is they're really not, and they don't have the minimum essential coverages that are offered by the Obamacare plans. They exclude pre-existing conditions. They don't have coverage for things like mental health, maternity. They'll have lifetime and annual caps on benefits. And so a lot of times people think they're getting more comprehensive insurance than they're really getting. Now, one of the other, and probably the major problem, is that when you go to use a policy like this and you have a major claim, a lot of times the companies that are issuing these policies are not traditional health insurance companies, and so they don't have their own claims units. A lot of them outsource that, and you might be dealing with a call center that's somewhere else. These companies are requesting medical records for up to 5 years in the past, oftentimes, to try to see if there's a pre-existing condition. And what I've seen is a lot of times they will interpret the word pre-existing condition very broadly. And so I've had cases where, even things like whether there was a broken arm or something like that, the company was looking to see whether it was a pre-existing condition, or where a lady had a mammogram, and later, well after the policy was in effect, was later diagnosed with breast cancer, and the company tried to argue that the mammogram was a pre-existing condition itself. So they really take this really broadly, Laura, and they, not only do they do that, but a lot of times these claims units they're swamped. They have too many claims. They're not dealing with them, and I see it taking sometimes a year or more for consumers to get their health claims paid when they are paid. And again, a lot of times we're really seeing rejections for pre-existing conditions for things that aren't pre-existing conditions. And so that's the real danger for people purchasing short-term health insurance plans. In Arizona, the technical name is short-term limited duration insurance, but they are plans that are sold by companies, often marketed as more comprehensive coverage than they really are, and they can really lose or help leave consumers in a real bind.
Right. So, if we want to get out of the short term health plans, how do we do that and what plan should we pick?
Well, I would say that if you know what you're getting into, then it's okay to buy a short-term health insurance plan. However, I would say the track record for a lot of these companies is not really good. If you want to make sure that your claim is going to have a better chance of getting paid, I personally would go shop for an insurance plan on the Affordable Care Act exchange. I would do it that way. Or I would see if I could get coverage through an employer through a more traditional plan. And there are some moves, recently, the president has expanded the open enrollment period. So I believe you can still enroll in an ACA plan right now.
Mm-hmm.
That's what I would do.
Right. Well, thank you so much, Inge, for telling us about short-term health plans. I hope you guys got a lot of knowledge from it. And if y'all liked the information, have any more ideas or comments, or have actual situations, please call us. And I hope y'all tune in next time. Y'all have a great weekend.
Thanks, y'all.